Well, that is a perfect segue, really, for our next speakers, which are Rosa Hart and Jeanette Lanoire. They're joining us from Norton Neuroscience Institute in Louisville, Kentucky. And that organization really fully embraces neuroplasticity and intentionally weaves it into its principles, into every stage of care, which is why part of the reason why they're joining us today. I want to have them walk us through what it is they do at Norton Neuroscience that is different and how it comes into play both at the front end of care and at that back end for physical therapy. So please welcome Rosa Hart and Dr. Jeanette Lenoir. Rosa and Jeanette are going to do exactly kind of what I just alluded to, which is tackle one of the most persistent and damaging myths in stroke recovery, the idea that the window for progress closes after 6 months or after a year. They're here to help us rewrite that narrative. And together, they really bring a powerful dual perspective to those rebuilding years because Rosa is a registered nurse. She's on the upfront piece of this. She's got deep post-acute care experience helping those individuals navigate through the process of finding care and what to do and how to go about it. And then after being dismissed, you will meet Jeanette, Dr. Jeanette Lenoir, who is the physical therapist and designs the rehabilitation programs that specialize in rebuilding your body, your cognition, your aphasia, whatever that program might be. So together they are here to show us that the brain's ability to rewire is not a ticking clock, but a lifelong capacity. And they're going to take us through some slides to give us a good sense of what they do and how it works and how neuroplasticity integrates into that. So, Rosa and Jeanette, thank you so much. I'm going to turn this over to you. I know Rosa is going to start our conversation, and then we'll segue into Jeanette, and then we'll come back to that Q&A session at the end. So please do drop your questions into the box at the bottom of your Zoom window, and we'll get to as many of those as we possibly can at the end. Rosa, it's all yours.
Thank you so much, Sherry. We really appreciate this opportunity. And yes, Jeanette and I have both worked together since we were working in the ICU with people immediately after stroke. And now both of us work more with people after they have gone home and they're in those later stages of recovery. So this means a lot to both of us because we've seen thousands of patients together. Today, I'm going to talk to you about rebuilding years after stroke. And I think it will answer one of those questions I saw in the chat about how long is there hope for neuroplasticity in our brain. So, neuroplasticity, as we have been talking about, is the brain's lifelong ability to change, adapt, and rewire itself. And I want to show you other examples of what that looks like in a human life. The names that I'll use have been changed for patient privacy purposes. So, 3 years after her stroke, Maria lifted her arm. Not during rehab, not during therapy, but 3 years later, long after she'd been told this is probably as good as it gets. She didn't cry. She laughed because she thought her brain was playing a trick on her. It wasn't. Most stroke survivors are given a timeline, 6 months, maybe a year. After that, therapy ends, progress slows, and hope quietly fades. As a nurse, I've sat across from stroke survivors and their families and watched their faces when they hear the words, however you are at 6 months to a year after stroke is what you can expect to be your new normal. But here's what we don't talk about enough. The brain
Rosa,
doesn't.
I'm sorry, I want to interrupt you just a
Go ahead.
second. I think that the slide needs to, I think it's stuck. If we can,
Okay. Let me
yeah.
press that again.
What should we be on?
Right here.
Okay, good.
I'm just mostly talking.
Okay, good. Thanks. I
Thank
wanted to
you.
make sure they weren't stuck.
Yeah, thank you. Yeah, so the brain doesn't follow our timelines, and recovery doesn't either. The idea that neuroplasticity, the brain's ability to rewire and adapt, doesn't shut off after 6 months or a year or even a decade It stays online, just waiting for the right signal. And let me show you another example of what that looks like. James was 7 years post-stroke. He walked stiffly, carefully, like every step needed permission. Strength wasn't the issue, and motivation wasn't the issue. His brain had stopped feeling his body. So instead of trying harder, James started doing something surprisingly small, somatic movement, like what you'll see from Dorothy Henning on day 4, I believe, of this summit with the Feldenkrais, which is a form of somatic movement. They use slow, gentle movements that are almost invisible. But week by week, something changed in James's body. His gait softened, his hip began to rotate, and his foot started to clear the floor. He didn't get physically stronger to make that happen. His brain remembered. Aisha's comeback looked different. 5 years after her stroke, her left hand still wouldn't move. She sat with a mirror in between her hands. Her right hand moved, and in the reflection, her brain saw two hands moving. And that illusion was enough. First, a finger twitches, then whole hand movement, then grip. The mirror didn't heal her, but it reminded her brain what was possible. And then Mr. Lopez, 10 years post stroke, a retired teacher with aphasia. He knew the words, he just couldn't say them. During therapy paired with gentle nerve stimulation, just tiny signals timed with effort, something shifted. Words started to come easier. Near the end of the treatment, he looked at his granddaughter and said, I love you. She had never heard him say that before. I mean, it had been a decade. So, what's really happening here? Neuroplasticity. The brain isn't a fixed machine, it's a living system. When one pathway is damaged, the brain builds detours, new routes, new connections, and not just early on in the beginning, but for life. And here's the truth. The biggest barrier to long-term stroke recovery isn't biology, it's belief. Survivors are told the window closed. Systems like insurance and scheduling appointments that stop investing in that recovery. So families stop hoping. But the brain never stopped trying. So, what if we told a different story? What if recovery wasn't something you ran out of, but something you could return to? Imagine a survivor waking up tomorrow thinking, maybe my brain still has something left. Because it does. Recovery doesn't expire, the brain doesn't give up, and neither should we. So it's time we stop telling stroke survivors when to stop and start giving them what their brains have been waiting for all along, which is a chance for a comeback. And now I'll turn it over to Jeanette to talk more about exactly how you can do that.
Thank you, Rosa. So now we are going to bring to even more light how this is seen in one specific human experience. But this story is not unlike several of people that I actually have had the ability to see over the past several years. So this is Ray. I want to introduce you to Ray, but I'm going to start a little bit before the time that I actually met him. His story begins with him growing up, playing basketball, and finding a love for singing. If you were to speak to Ray about his days as a shooting guard, there's one thing that he very much likes to say, and that is that he does not miss a shot. So when I first heard this, my question was, okay, did this confidence come from maybe an overt exaggeration of the days that he loved shooting the ball, or was it something that he really just developed such a high skill in doing? And to be honest, it was actually the later. His shooting percentage was very high. So successful that he was able to not only play in high school, but was able to continue on into college and was able to play into some semi-pro leagues. Now, how did that actually happen? Well, his brain used neuroplasticity, right? So, in order for us to learn a new skill or to relearn a skill, we still have to apply these neuroplastic properties. So, I'm going to speak about the four active ingredients, and these are things that I actually teach everybody that I see. So, applying it to the time when he was playing basketball into shooting a ball, he had to continue to be challenged, and that's where intensity plays a role. He had to do those close range shots and get those to be successful with those, and then he moved into his free throw level, and then to the 3-point line, and then even beyond that. Then salience. It must matter to you enough to do it. So he fell in love with the game of basketball, but it eventually led him to more opportunities that made him even more important to be able to practice and be good at it. Repetition. So you have to practice, fail, evaluate, and readjust. Now, I'm sure those were several shots that Ray actually took and missed growing up, but he continued to practice. He readjusted, he reevaluated, and then was able to be successful. And then specificity, the type of training matters. So once he mastered those open shots, he continued to change the way he trained with them. Maybe he did it without anybody guarding him, to somebody guarded him. Maybe he dribbled and then shot. For those of you in America and it being March, we know March Madness is just around the corner. So all of this really kind of hits home over the next couple weeks. So that leads us into literally the night that Ray had his stroke. Within hours of him having a stroke, he played 2 basketball games and actually stopped by an open mic night in town, and even sang that same night. Then that started his recovery journey. So, this is actually shouldn't feel really unfamiliar to most folks who have had a stroke. He was in the hospital for a period of time, ended up in inpatient rehab, and then was referred to an outpatient facility where he saw physical therapy, occupational therapy, and speech therapy. After that, he had to have another surgery, went back into the hospital, was able to have another inpatient rehab stint. But by that time, which was towards the fall, kind of more the end of the year, he had exhausted all of his outpatient rehab visits for the year and was unable to continue on with rehab past that. So that would have been the end of 2019. Okay. So with that, that's kind of where I start to step into the picture. I actually met his wife at a community event around the holidays in which she shared his story with me a little bit. I met his wife the end of 2020, and found out that Ray had not been doing anything since he was discharged from inpatient rehab the end of 2019. So I was able to get him into the clinic and I evaluated him the beginning of 2021, and which was about 2 months shy from 2 years of when his stroke actually happened. So I met him at about that 2 year mark, which is really important because most of the time, especially during the rehab course, we do hear, or I've had patients even say, and I've even said it, on average, it takes the brain about 18 months to fully heal, right? But that doesn't mean that you can't make progress after that. And Ray's story, I hope, resembles that even more. So when I first met Ray, right around that 2 year mark, his goals were very sound. He wanted to maximize his independence and he wanted to be able to walk. All right. At this point, he was dependent for all of his transfers. He was not walking at all, and he spent majority of his time in a hospital bed. So going back to those active ingredients of neuroplasticity, we utilize those same principles to be able to make the progress that we have made since meeting him in 2021. We go in to first that intensity. It must challenge you. So we started doing very challenging things. We had to get him accustomed to just being upright. So standing on his feet for prolonged periods of time, in which we did. That turned into us standing and taking steps to standing and continuing to walk. Salience, it must matter enough to you. His wife and his daughter actually had some back related injuries due to transferring him after so long, which really gave him even more purpose of wanting to make sure that he can do the most that he can to prevent further injury for his family, but also to maximize his function. There were several times in which we stood up and we fell back into the table. We stood up, we fell back into the table, and it allowed him to kind of readjust and evaluate those principles for him to really figure out what do I need to do to be successful. And once we got that, we continued to practice and practice and practice. And then specificity, how we train really does matter. So after that, we started challenging him once he got on his feet. Maybe it was now we're going to try to shoot into a basket, coming back to the basketball days. And I can confirm that Ray does rarely miss. And so that continued on into now maybe we are standing in bars. Maybe we're standing and walking outside of the bars without hanging on to anything. This continues to grow. So this is a picture of me and Ray. This was actually at least 2 or 3 years ago. For now, we need an updated photo. He is ecstatic to be able to share his story, and we're currently writing some papers on him and just about the continuity of care. But this is Ray up on his feet where we are running laps in the clinic, and he's one of the most hardworking people I know, to be honest. But those principles of what allowed us to finally be able to take steps and for him to be able to walk with less and less assistance over the years. Now, like I said, it's been 7 years since his stroke. He's now able to transfer with little to no assistance. He's able to stand at home on his own as long as he's hanging on to something. And we actually are at a point that we're starting to take a couple steps at home too, which is huge. So how is that possible? I said earlier we get told a lot of times that our brain heals in that 18 months, and I saw him way past that 18-month period, right? So, like Rosa said earlier, the brain can't remember, and his brain is continuing to find a way to reconnect to allow him to continue with his recovery. And that brings us to the point that stroke recovery isn't just within those 18 months, it's a lifelong journey. Neuroplasticity doesn't just apply in the world of when our brain is trying to relearn. It's something that we've had all along, right? But it's something that we can utilize in all aspects of our recovery. If you're willing to work for it, then you can achieve it. And I'm going to leave you with this. If it doesn't challenge you, it will not change you. And I'm a strong advocate for being able to be seen at least once a year if you're someone who's had a stroke. I think finding a rehab team that will continue to challenge you and give you meaningful tasks to get you to achieve your goals is going to be the key to success for that. But it's not something that we just stop doing. I see every year since I've met him. I have him in some active programs in which he gets seen through some pro bono work with schools around town. So he continues to move, stay on his feet, and continues to work towards his goals. We still have that insurance visit limit. He still has about 25 visits a year, and that's a hard max. So we have found to find alternative ways to get him in so he gets rehab longer throughout the year. But that is the key to success, is finding someone that will continue to challenge you because of this principle right here. Once our brain gets used to it, It needs a different mode of training, so it continues to be challenged, so it continues to relearn.
Thank you, Jeanette, and thank you, Rosa. Those stories were so impactful and empowering. My goodness, Ray's story. Thank you for walking us through that long journey, that 7-year journey. It's remarkable to me how much recovery he's made over that time and continues to make. And if that doesn't dispel the myth that you can't rewire your brain, I'm not sure really what would. And I see comments in the chat here. I'm going to tell my husband to start OT tomorrow. So I think you guys have done and completed your mission for the session today. Thank you for that. I do have a couple of other questions, and please, if anyone else has another questions, we've got another couple of minutes. Drop them into the Q&A box on the bottom left. I've got somebody asking to explain how mirror therapy works just in a little bit more detail. Rosa, do you want to take that one since you brought it up, or should we turn it to Jeanette?
Let's turn it to Jeanette. She has all these degrees in that.
Okay.
Yeah, mirror therapy is awesome. Our brain, I always tell folks that the eyes are our windows to our brain. And so a lot of times we need to see our limb moving. And when that mirror comes and it shows us a mirror image of what that, let's say it's the left hand is affected and the mirror is looking at the right hand, it sees that left hand movement. Those pathways actually fire up, regardless of them being fired up at all before then. So it helps establish that connection just because you're using your vision to get that input, so you are able to bias your output.
Yeah, it kind of goes back to that principle you guys had on your slides that what your brain believes is
Mhm,
what it will do and how it wants
mhm,
to perform. So that mirror therapy is this tricking it, if you will. You want to say that this is what you should believe. It's changing the reality of what it
mhm,
believes. Yeah, and can you guys speak up? We've got another couple of questions around depression and how that influences stroke recovery. Can you speak to that a little bit and how you address that in your treatment processes?
Sure. And could probably speak to that somewhat, especially like there's a connection between anxiety and depression, right? If you have had a stroke, you have a real reason to feel anxious because something really scary just happened to you. And that means you understand how serious it was. But it's important to learn new coping mechanisms that you may not have had before, like grounding yourself in the present and what is real right now. But then also for addressing the depression that can come into play. People's function may have been inhibited if they were a musician before and they can no longer play their instrument that gave them a real sense of meaning, or if their mobility is inhibited to the point where they can't go to their church like they were, or whatever social group they normally met with every week. And if they can't maintain those social connections, then they can start to lose hope and feel a lot more depressed. And so, we cannot underestimate, we really can't afford to underestimate the power of connection with people and activities that give meaning to our lives because um, anxiety and depression, those things don't happen in a vacuum. And there are things we can do about it. Like Jeanette leads a stroke survivor support group where people can meet other people who understand what they have gone through and they can talk that through with each other either in person, or there are virtual support groups that are really helpful for that. And I think just getting people out of this, oh, I can't be like I was before, so what is life even about? Finding new source of meaning and then also hope for returning to the activities where they can, or new activities that will give their life meaning is incredibly important. So they'll want to participate in therapies to get stronger.
Yeah, thank you, Rosa. That and those support groups that you run, Jeanette, are so helpful for that piece of it. And what's amazing about your support groups is that you have this perspective of neuroplasticity. You can build the emotional support and pair it with the actions that you can go and do yourself. And there was a question about that as well. If you're not and you don't have access to therapy, because you did talk about that, your insurance typically will cut off your therapy after some sort of time. And physical therapy is, because of the number of sessions you go to, expensive. How can individuals um, use their appointments with a physical therapist to then create an advance a program on their own that can minimize the number of times they have to see a physical therapist? How do you weave that into your treatment? I know that that's something you've thought about, Jeanette.
Oh yeah. So everybody I see has a program. And I know at the very beginning if we have a hard max limit. I know if the insurance piece is going to be an issue, depending on the time of the year. If it's the beginning of the year, I'm not choosing to max out their visits at the beginning of the year. A lot of times, my main job, and I tell folks this all the time, is you don't come to me to get better. You come to me to learn how to treat yourself so you continue to get better. And I think that's the big piece of it here. You have to be a little strategic with this. A lot of times, especially here, I'll have a max visit limit of 25, but so does occupational therapy too, which a lot of times that means, okay, you're going to see me for a couple months and then we're going to go into occupational therapy, all right? After I discharge you. Now we made that a 4 month stint. Now you're going to take a couple months, you're going to really apply everything we learned. You're going to keep practicing. You're going to keep on with the program we just taught you, and then you're going to come back and we're going to do it again. All right. So there's a lot of strategic ways in which we can kind of be conservative, really maximize on the programming. But to be honest, everybody has a program. If you only do the things that you're doing in therapy during that time, you're not going to get better because your brain needs repetition and it needs that every day. There should be things that you are doing at home that will actually significantly improve the gains that you'll actually make.
And
Okay, thank you, Jeanette. Oh,
and I
go ahead. Go ahead,
I
Rosa.
definitely want to use this time to let people know they are welcome to join in on any of our free virtual programming from wherever you are. If
Mhm.
you log on to the Norton Neuroscience Institute Resource Center page, nortonhealthcare.com slash NNI classes, there's neuro yoga, neuro tai chi. And so they make these modifications depending on your, chronic thing that you're dealing with. And you're welcome to join in on that at no extra cost. So hopefully it can supplement when you're not able to go see your beautiful physical therapist every day.
Thank you. Yeah, and I do really encourage you guys to take a look at that. You in the audience, please do explore that because they genuinely integrate neuroplasticity and weave it into all of their activities at Norton Neuroscience. So give Rosa and Jeanette a call. They'll walk you through where to go. You've got the information there. And I will also ask you to please take a few minutes, fill out a poll on this session. I've got a couple of comments here in the chat that is complimenting the presentation that you gave today, and it was very clear and lots of helpful information. And those case studies and examples you shared are tremendous value. I'm seeing the comments about that now. So, Jeanette and Rosa, I will see you both soon in Kentucky. Thank you so much for your help today and for making sure we all understand neuroplasticity and dispelling the myth that you can recover from stroke at any, or dispelling the myth to know that we can recover from stroke for many, many years after. Thank you.
Thank you.